Today we're talking about providing care for first-time moms.
So now moving into some background info, the average age of first-time mothers is 27.5 years old in the United States. Almost 2/3 of first-time moms in the U.S. under 25 years of age are single. Nearly 3/4 of mothers were rated as having low maternal health literacy. And in the U.S., the cost of any sort of health care may be extremely expensive, and many first-time moms have trouble affording it.
When reviewing our population needs assessment, we came up with 3 key results. Psychological factors that may affect learning include stress about having a newborn child, lack of sleep, an unhealthy lifestyle, and an overwhelming amount of new responsibilities. Additionally, a lack of education is directly related to low health literacy. Examples of important health topics for new moms include breastfeeding, baby formula feeding, checking the baby's temperature, safe medication administration, car seat safety, and newborn baby hygiene. Postpartum distress is any psychological problem that impairs daily functioning, encompassing a range of experiences such as anxiety and stress. Mothers in the United States with a migrant background or little connections may experience geological and emotional displacement as they experience the postpartum period. Providing resources such as regular mental health screening, supplies and diapers, and education regarding breastfeeding will help meet the social and emotional needs of first-time moms living in the United States.
The theory of planned behavior is a useful tool to examine maternal attitudes, subjective norms, and perceived behavioral control, which together influence intentions and ultimately behavior. Attitude refers to a mother's positive or negative evaluation of a specific behavior. Subjective norms refer to a mother's perception of social pressure to perform or not perform a specific behavior. Perceived behavioral control refers to a mother's belief in their ability to perform a behavior influenced by external factors. The theory of planned behavior framework is commonly used to understand maternal behaviors such as breastfeeding, which is pictured on this slide, healthy eating, and vaccination. Understanding a mother's perceived attitudes and norms around specific behaviors can allow first-time moms to develop and foster habits that encourage their infants to flourish.
Our goal is to equip healthcare workers to provide more emotional and educational support to first-time mothers in the United States. Our first SMART objective is that by December 2026, 80% of first-time moms in the U.S. will receive a mental health screening. Our strategy is to implement PHQ-9 questionnaires at every prenatal and postpartum appointment. Our evaluation plan is to analyze the number of first-time moms that complete this questionnaire. And our call to action is to encourage first-time moms to fill out the PHQ-9.
Our second SMART objective is that by January 2026, 90% of first-time moms in America who are unable to afford diapers will receive them from pantries. Our strategy is that free diaper pantries will be located and clearly mapped out on a resource. The evaluation plan is to analyze the number of diapers handed out to first-time moms at each pantry. Our call to action is hand out pantry location and public transportation information to first-time moms. Our SMART objective number 3 is that by May 2026, 85% of first-time moms in America will understand how to breastfeed. Our strategy is that each postpartum appointment will include informative demonstrations on how to breastfeed. Our evaluation is to survey before and after every appointment to see their understanding of breastfeeding. Our call to action is to ask patients to teach back correct breastfeeding techniques.